Being a woman is supposed to be magnificent. However, behind the beautiful facade there are problems that all women faces that are beyond our comprehension. After puberty, every woman would experience menstrual period once every 28 days on average, which lasts between 3 to 7 days. On a deeper understanding, there is a series of hormones in the body that rises and fall at different times within the 28 days menstruation cycle. In the first stage of menstruation cycle, low levels of hormones cause the womb to actively shed the lining that was built up in the previous menstrual cycle, which is the menstrual period we all know. In between every 2 consecutive menstrual periods, different hormones in the body will cause several events to occur in preparation for pregnancy. The ovaries will be stimulated by hormones to produce and release a matured egg into the fallopian tube, which then moves towards the womb and live for up to 24 hours. Another set of hormones causes the lining of the womb to thicken with nutrients and blood in preparation for a fertilized egg. If the egg is not fertilized, symptoms of premenstrual tension or PMS such as breast tenderness, bloating, lethargy, depression and irritability happens at this stage. Then, the hormone levels decrease, and the build-up of thick womb lining starts to break down, where your body sheds the lining as menstrual period again. In many ways, the health of a woman's reproductive system affects her physical and mental health. As we age, our body is subjected to many kinds of changes that affect our bodily systems, including the reproductive system. Feminine problems are such as hormonal problems, infection problems and others caused by aging. Hormonal problems cause menstrual disorders and decreasing vaginal lubrication. If prolonged, symptoms start to develop such as swelling of the lower abdomen, depression, mood swing, vaginal dryness and skin pigmentation. Hormonal problems are suspected to cause uterine fibroids to grow and cause heavy and painful menstruation, painful sexual intercourse, and urinary frequency and urgency. Some fibroids may also interfere with pregnancy. Enlarged fibroids may require medical operations to remove them. Hence, it is vital to have a healthy hormonal flow in the female body to prevent these problems from developing. Infection problems can come from bacterial or fungus infection. Naturally, lubrication fluid is secreted from the wall of the vagina, which also helps to clean away minor infections. However, when the body immune system is low, and when the hormonal problems causes vaginal lubrication to decrease, infection risk is increased, even from using the public toilet. As a result, symptoms such as abnormal white discharge, foul odor, itchiness and burning pain during urination can develop. Many women are not aware of the hormonal and infection problems that they may be facing. When the problems become worse, the risk of developing cancers in the female reproductive system is increased. As most women are insensitive to pain in the reproductive system, cancer may develop up to 3rd or 4th stage before realizing. Another problem that some women may encounter is prolapsed uterus, when the uterus drops down and presses into the vagina area. Muscles, ligaments, and other structures hold the uterus in the pelvis. If these tissues are weak or stretched, the uterus drops into the vagina canal. This condition is more common in women who have had 1 or more vaginal births. Other things that can lead to uterine prolapse include normal aging, lack of estrogen after menopause, conditions that put pressure on the pelvic muscles such as chronic cough, obesity, and carrying heavy objects in the period after giving birth. Repeated straining to have bowel movements due to long-term constipation can make the problem worse. Let us introduce our product to you called KIMIS. Like all our other products, KIMIS is subjected to quantum molecular technology, where its large water molecular clusters are reduced in size, and the important trace element compounds are freed for cell absorption. Just spray a light mist onto the triangle area, where the female reproductive system is located, 4 fingers width below the navel. Also, using fingers of the other hand, spread open the vaginal lips, and press another spray of KIMIS into the vagina. Repeat these steps for 8 to 10 times per day, if encountering hormonal problems, infection problems, or uterine prolapse. If medical ointments are in use, make sure to use KIMIS at least 2 hours before or after application of the ointment. KIMIS works to nourish and improve the cell condition of the female reproductive system, so that your natural cells work to prevent and fight infections, to improve the balance of hormone flow, and to strengthen the condition of the muscles and ligaments of the womb and its surrounding. Make it a habit using KIMIS to prevent infections. KIMIS has trace element compounds such as manganese, selenium and germanium that help to eliminate odor and reduce itching, prevent infections at the vagina, cervix, uterus and the fallopian tubes, prevent uterine cancers and protect against free radicals. Reduce hormonal problems with KIMIS. KIMIS can help to activate the ovarian function, improve lubrication of the vagina, promote blood circulation, regulate and balance internal secretion of hormone, and prevent premenstrual syndrome. KIMIS helps to heighten female reproductive health, to maintain a healthy muscle function and helps to tighten the vagina. As KIMIS is 100% natural and chemical-free, there are no known chemical side effects. However, as your reproductive system is becoming healthy and depending on the problems faced even without your realization, users will experience several healing reactions such as changes in your menstrual period and menstrual cycle, itchiness, white discharge, old wounds reoccurring, etc. These are all good signs that the womb is working to cleanse and heal itself. Please continue to use KIMIS until the healing reactions subside, as KIMIS is safe with no chemical added in it. In time, you will notice that the color of your period will turn from dark to bright red, which indicates healthy new lining being shed for every new cycle. It is time to let KIMIS keep your reproductive system healthy. After all, to stay healthy is your responsibility, not anyone else. Thank you.